Today saw a number of significant medical developments in the coronavirus outbreak, including a new study casting doubt on the accuracy of that rapid testing system that's used by the White House itself. We'll have more on that tonight. Also, the CDC preparing to alert health professionals to a dangerous and potentially life-threatening condition in children that is linked to the coronavirus. We're going to talk to a dad who nearly lost his son, along with the boy's brother who provided life-saving CPR for his brother. It's an incredible story. In addition, there's new research that's come out today showing the virus can attack far more than just the lungs. It is, according to the study, a multi-organ killer. Yet with all that, with states being left to fend for themselves largely when it comes to testing and contact tracing, with detailed CDC guidance on safely easing quarantine measures being slow-walked or even withheld from states, with so many hard realities facing Americans, including the anticipated loss of millions more jobs, the president again today chose to focus his attention on a different element of the pandemic. He chose to pick a fight with his own top medical expert, Dr. Anthony Fauci, apparently because Dr. Fauci, during Senate testimony yesterday, chose to acknowledge the realities that he's got 4 decades of experience facing when it comes to viruses and public health. Now, here's some of what Dr. Fauci said yesterday about schools and businesses reopening too soon.
My concern that if some areas, cities, states, or what have you, jump over those various checkpoints and prematurely open up without having the capability of being able to respond effectively and efficiently, my concern is that we will start to see little spikes that might turn into outbreaks.
Dr. Fauci went on to talk about schools reopening some places as being a bridge too far. To expect a vaccine or widely available treatment for COVID-19 by the time that students return in the fall. That was the bridge too far, though he expects optimism a vaccine would be developed in the next year or two. He also told senators he did not have a confrontational relationship with the president. Well, here's the president this evening.
Dr. Fauci yesterday was a little cautious on reopening the economy too soon. Do you share his concern?
About reopening what?
Reopening the economy too soon, some states.
Look, he wants to play all sides of the equation.
Keep it honest, it's not even clear what that means. Playing both sides of what equation? The president was asked to elaborate. He called what Dr. Fauci said, quote, not an acceptable answer. Again, not sure what that means either. Not acceptable politically? The doctor wasn't testifying in a political capacity. He was talking about the public health realities of a virus it's already killed more than 84,000 Americans and is projected by modeling that the White House itself has relied on in the past, although who knows now what they rely on. They've relied on in the past. It now projects nearly 150,000 people in this country will die by August. Tomorrow, the government official who was pushed out allegedly for questioning the president's former wonder drug, hydroxychloroquine, testifies before House lawmakers. He's expected to warn, quote, if we fail to develop a national coordinated response based in science, I fear the pandemic will get far worse and that 2020 will be darkest winter in modern history. CNN Chief White House correspondent Jim Acosta joins us right now with more on this and the response to doses of reality like that and from Dr. Fauci. So, Jim, what are you learning about the president and the coronavirus death toll? Because there have been rumblings now for quite some time that the president, and even publicly, the president sort of seemed to be questioning the death toll itself, that it was somehow phony in some way.
Yeah, my colleague Kevin Liptak and I, Anderson, we've been digging into this. We found that not just the president who is questioning these numbers, but senior officials inside the White House, inside the administration, are questioning whether or not that overall coronavirus death toll for the United States is accurate, and essentially whether or not that number is too high. They feel like the number may be overcounted at this point. We've heard the president make some rumblings about this in the past, but one reason why they're concerned it's too high, according to a senior administration official, that grim death toll obviously guides their policy. They can't be in as much of a hurry to reopen these states and schools and all sorts of other facets of daily life if those numbers are weighing down those decisions. And so they've been talking about this behind the scenes at various meetings as to whether or not the data can be believed, and they're in the process of doing that right now. That does fly in the face of what Dr. Anthony Fauci, who you just mentioned, has been saying. He testified yesterday during that hearing that, if anything, the number of dead has been undercounted because, for example, in New York City, you had people dying at home not being counted as official COVID-19 fatalities. And so, once again, there was tension between the scientists and the political people inside the administration.
I mean, I can't think of anything more offensive to a family than to have the death of their loved one, the reason for the death of their loved one, rewritten by the White House or the administration in order for whatever purpose that may, political purpose that may be. It just seems really just it's so fundamentally wrong to do that.
Absolutely, Anderson. And if the public can't trust how the administration is handling the numbers, just the numbers, the scope of this pandemic here in the U.S., I think it's a fair question to ask. How can the public trust everything else that they're saying at this point?
The president's also lobbying some criticism at Fauci. We heard him saying there that he's playing both sides of the equation. I'm not sure what the two sides are. I mean, I didn't know there were sides in a pandemic.
Yeah. Well, our reporting has been all along, Anderson, and I think it's been your observation as well, that Dr. Fauci has been on the side of science from the beginning of all of this. But the president, you're right, was taking some shots at his top medical expert, talking to reporters earlier this afternoon. He was mainly taking issue with Dr. Fauci's assessment as to whether or not schools should be reopened. Fauci has been urging a lot of caution in that area. And the president was asked at one point, well, what do you mean when you say that Dr. Fauci is trying to be on all sides of the equation? And here's what he had to say.
When you say Dr. Fauci is playing both sides, are you suggesting that the advice he's giving to you is
I was
different?
surprised by his answer, actually, because, it's just, to me, it's not an acceptable answer, especially when it comes to schools. The only thing that would be acceptable, as I said, is professors, teachers, etc., over a certain age. I think they ought to take it easy for another few weeks, 5 weeks, 4 weeks, who knows, whatever it may be. But I think they have to be careful because this is a disease that attacks age and it attacks health. And if you have a heart problem, if you have diabetes, if you're a certain age, it's certainly much more dangerous. But with the young children, and students, it's really, just take a look at the statistics. It's pretty amazing.
And Anderson, the president went on to say, well, young students who are traveling, to school and heading into the classroom, they're young. They can withstand all of this. The science has shown in the last several days that that's not the case, that there are mysterious illnesses that are striking some of these kids who contract the coronavirus. And there's obviously the issue of, well, how do you open schools and universities across this country if you have elderly people teaching classes, working as principals, working as head coaches of sports teams, and so on? And so this was another one of those examples, Anderson, of the president riffing about how to reopen society when scientists like Dr. Fauci are just trying to stick to the facts in all of this and trying to arrive at a conclusion that works for everybody.
It also ignores the other obvious reality, which is that children go home to families and parents, and in some cases grandparents that they live in or with, or aunts and uncles, and maybe the kids are fine, but they can pass the virus along in that way. Jim Acosta, stay with us. I want to bring in Sina's political analyst, New York Times White House correspondent. Maggie Haberman is joining us. Maggie, the reporting that the president is privately questioning whether coronavirus deaths are being overcounted, I mean, it doesn't come as a surprise. He was raising questions about the death toll in New York when New York started looking at people who had died at home and didn't necessarily test positive for COVID, but it was assumed that they did have COVID. Deaths at home have obviously gone up an unusually high amount. I mean, I guess it shouldn't come as a surprise that he's now more forcefully, and the reporting is more widely in the White House questioning this.
Right. Anderson, I think it's important to note that the president is not alone in this. There are a bunch of folks inside the White House, among them, according to what we've heard and I think what others have reported, Dr. Deborah Birx, who has raised concerns about specifically some of the information coming out of the CDC. I think that there has also been questions about how people are counting these death tolls. Look, from one standpoint with the president, what he could be talking about, and I think he has talked about before, is that he is suggesting it just creates this very high number that I think he thinks is being used against him in some way politically. I think there are other questions about whether it is to the advantage of states to have higher counts as they are looking for aid or help. There has been a push-pull with this White House and the states, particularly New York, for a while about whether there is an over-ask by the state and local governments, whether they're asking for too many supplies, whether they're asking for too much money, whether they're asking for X, Y, Z. You know, there are often these kinds of push-pulls, as you know, between states and federal governments. But in this case, it's relating very specifically to the death toll numbers. You know, Fauci testified about this yesterday and said that if anything, he thinks the count is low, which was striking in comparison to what we've heard the president say and what some others in the White House are saying.